Cesarean deliveries here in America are on the rise at a fast pace, and it's quite worrisome. For those of you who don't know, a cesarean delivery is an abdominal surgery with short and long-term consequences, such as surgical complications, admission to neonatal intensive care units for the fetus, higher costs compared to vaginal delivery. There are now clinical guidelines aimed at reducing non-medically necessary C-sections. So the abdominal surgery is performed in a sterile environment. They cut your abdomen, usually along the bikini line. They cut through the muscular wall, use a spreader to open the abdominal cavity, and ultimately slice the uterus with a scalpel and pull the fetus out. That is a cesarean section. So, why are C-section rates getting out of control? Well, there's lots of reasons. There's patient preference, moms who would much rather have a 6-inch scar on their bikini line than suffering through vaginal delivery. So 1/3 of all deliveries in 2011 were cesarean, according to the American College of OBGYNs. Rates range from the low 23% to almost 40% across the nation. Florida is the third highest at 38.4% of C-sections. The increase in C-sections can also be caused by health conditions such as preeclampsia, placenta previa, placenta abrupta. So preeclampsia, which is one of the leading causes of C-sections, is the active high blood pressure during pregnancy. And I'm not just talking like 130/90, I'm talking like 180/110. If the blood pressure gets that high, that means the baby and or fetus, depending upon how you look at it, are not getting enough blood flow because the blood is pumping too fast and the baby's not getting what the baby needs. Things like gestational diabetes causes macrosomia. So gestational diabetes is a diabetes condition that only happens during pregnancy. Macrosomia is an overly large baby. So some babies are born 8 pounds, 10 ounces. When you start pushing into 9 pounds, 13 ounces, 10 pounds, then you're talking macrosomia, which is not good for the mom or the baby because the baby, when it's that large, cannot go through the birthing canal. It will not fit through the pelvic bones and could cause more damage to the baby and to mom than would be the case if there was a C-section placed. Problems with the placenta, like placenta previa. So placenta previa is when the placenta starts to separate from the endometrial lining quicker and sooner than it should. Placenta abrupto is where the placenta just separates from the endometrium and we need to get that baby out real quick, because if you don't, you run the risk of not only a fetal demise, but a maternal demise as well. So how do we help and aid in reducing the number of C-sections? So reduce the amount of inductions. Inductions are supposed to aid in cervical ripening, which allows the cervical opening to open, which allows the baby to pass through the birth canal. Now, there have been studies that have shown that the indication and usage of inductions is actually increasing the cesarean section rate. Doctors are becoming impatient. They've sat at the hospital for 24 hours. The mom hasn't progressed past 3. That's it. We're done. Let's do a C-section. No. Patients need to learn to be more informed and more educated when they're going to deliver. So another way to aid in less inductions equaling less C-sections is continuous labor and delivery support. Hospitals need to start utilizing the amazing benefits of having a midwife or doulas in the birthing unit with the parents. Continuous maternal support is shown by the American College of OBGYN that they recommend continuous labor and delivery support. Someone who is there constantly to support the mom when the mom is just tired and drained and in her absolute weakest moment. Use of those support systems will aid in a decrease in cesarean rates. Possible mistaken dates. Now, as we all know, pregnancy is not an exact science. It is not mathematically 100%. This is the date you conceived, unless you were artificially inseminated. This is the date you conceived. This is definitely the date that you're going to deliver. Sometimes your dates are wrong. So we need to try to give the mother more time to carry her baby and accept that when that baby is ready to come, the baby will come. That will allow for more successful vaginal deliveries. If the doctors take more time with their patients and utilize other measures before inductions, the C-section rates would definitely decrease. C-sections can be caused by many things, doctors being impatient, health conditions like preeclampsia, placenta previa, placenta abrupto, gestational diabetes. They need to start using the support system that we have, like midwives and doulas, in order to decrease these rates. 1 in 3 C-sections here in America is not safe. It's not safe for mommy, and it's not safe for baby. C-section rates are scary.